In 1999, my one-year-old nephew Hayden, who's there in the right, was diagnosed with a rare and fatal disease. 1 month later, my daughter Cameron, there on the left, was diagnosed with the same disease. We were 4 parents, 2 children in one family facing the impossible. A year and a half later, my husband Charlie is with his brother Tim at Hayden's bedside. Hayden is dying. I am home with Cameron, absolutely terrified. Terrified at the thought of my brother and sister-in-law who have to watch their son die, and terrified because I know that my husband and I have to do the same soon enough. My fear and anxiety about this one thing is so great that I think I might actually break apart. And then Charlie calls. He tells me that Hayden is comfortable, that things are peaceful, that Tim and Allison are okay, and that we are going to be okay. And in that one moment, the worst of my fear dissipates. If they can do it, we can do it too. And I am able to live and breathe into the last 5 months of Cameron's life. And we were okay. And I think we were okay for 2 reasons. First and foremost, we were not alone. We traveled that road with my brother and sister-in-law who led the way. Parents seek other parents. They trust them, they learn from them, but parents like this in this situation are very hard to find. Secondly, we received pediatric palliative care. This is a specialized form of medical care that is much, much broader than hospice. It can begin at the point of diagnosis and be delivered concurrent with curative treatments. It focuses on quality of life for the child and the entire family. This means symptom management and support for the psychological, spiritual, and emotional well-being of that family. But most parents don't know what palliative care is, and they don't know where to find it. I wanted to bring these 2 things that helped my husband and me back then to families who are in it today, and this was the seed for Courageous Parents Network. Each year in the United States, 53,000 children die from a life-limiting illness, and another 500,000 are living with serious illness. This means there are approximately 1 million parents who are experiencing grief, isolation, and anxiety. And while the medical needs of their children are typically well met, the psychological, spiritual, and emotional challenges typically are not. There just aren't enough resources out there to help these families. And in the absence of adequate help, there can be long-term negative impacts. When parents are at risk, the entire family is at risk. The number 1 predictor of child well-being is parent well-being. So, here is what we do. Courageous Parents Network is a web-based model that delivers digital resources that shine a light on the very difficult issues that these families face. They teach parents about palliative care. They feature experts who provide professional guidance around issues such as coping with the diagnosis, working with the medical team, tending the marriage, caring for the other siblings. And they bring parents into virtual community with other parents through videos. In these videos, parents who have gone before share their experiences, wisdom they have gained, coping strategies they've used. They answer some of the very scary questions that parents are often afraid to ask, and they show parents that they are not alone. And because our model is web-based and free, it is available 24/7 to parents wherever and whenever they need it. In the parking lot, a lot happens in the parking lot. In the quiet of their home in the middle of the night, or at their child's bedside at the hospital. This is a very effective way to promote family resilience and healing. We launched only a year ago, and despite limited outreach and absolutely no marketing, we are already finding our audience and meeting with success. Parents crave this information. as do the providers who work with them, who are always looking for valuable, trustworthy, easy to access resources that they can share with the families they care for. But there is so much more to do. We're very young. We need to build our organizational capacity, refine our model, develop new content, expand our network, and expand our reach. Specifically, we intend to produce 100 new videos based on feedback we're receiving from parents and providers, develop content in Spanish, develop a podcast series, and develop interactive parent engagement tools so parents can connect with each other in real time. We are also going to reach all 183 children's hospitals in the United States and at least 25% of the 1 million parents who need this help. We can do this with an investment of $1 million over the next 2.5 years, and we've already raised 25% of that. And we hope you can help us go the rest of the way. Most of us, when we think about pediatric disease, think about cures and research. And cures and research are critical. But I am asking you to think about something different. The well-being of families in the here and now. These parents who are going through this today need help today. Courageous Parents Network is a very effective way to reach families who are going through this nationally today. Thank you.